Hello, this is Dr. Edward Fruitman. I'm a medical director of Trifecta Med Spa. This is May 2025, and Trifecta is launching its weight loss program that's going to be based on popular semaglutides, the Ozempic and Mounjaro, or what they're also known as Wegovy and Zepbound. The reason why we're doing it at this time is that we do know that a lot of our patients have lost substantial amount of weight using those semaglutide compounds, and due to the fact that they're often not covered by insurance for cosmetic weight loss, they are just about to lose access to their compounded medication. Officially, the shortage of those compounds, semaglutides, is over, and therefore the legitimate supply of compounded medicine would be rather short. A lot of my patients express substantial anxiety, being fearful that they would lose the progress that they have made. I understand that anxiety very, very well. I myself have lost about 50 pounds using those compounds, and I'll tell you, as a doctor who have practiced weight loss medicine for over 30 years, I would say the timeline is evenly divided as before Ozempic and after Ozempic. All of the weight loss remedies that we had available just simply weren't helping me for long enough. And I find that the semaglutides are nothing short of a medical miracle. More and more literature comes out at the benefits of those products, and so far the positives have way outweighed the negatives, including not only weight loss and risk of diabetes, heart attacks, strokes, high cholesterol, all the other things that would be associated with weight loss, but also general inflammation in the body and some of the common and rare diseases that put people at much less risk if they are using semaglutides for weight loss. So our plan is as follows. We're planning to partner, and we have partnered already with Lilly and Novo Nordisk, the manufacturers of those compounds. We're planning to secure for our patients the supply of those medications at a discounted price. Think very wisely, both Eli Lilly and Novo Nordisk, the manufacturers of semaglutides, have decided to substantially reduce prices on those medications and will provide them directly to consumers, being mailed from their central location. In the era of compounding being substantially restricted and the fear of illegitimate compounded products, I think it's a reasonable and safe alternative to get medications directly from manufacturer so that you don't have to worry about potential adverse effect of compounds that you would inject into your body when you don't know the origin and manufacturer. This is my personal plan, and I want to offer it to our patients as well. Many patients have succeeded in losing weight. Some patients are still in the middle of the journey. There is not a clear recommendation of maintenance treatment, and yet I see a lot of people who are willing to continue those medications on an individualized dose to maintain the improvements that they have had. We will do our very best to assist all of our willing patients on this journey of maintaining and improving their health and maintaining and improving their appearance. Our program at this point would cost $99 a month on a subscription model and would include 4 essential components. I designed this program myself, and I'm very convinced that the quality of service would be of the kind you would expect from Trifecta Med Spa. So this is what we hope to offer for that price of $99 a month. One is consultation and prescriptions with medical providers would be responsible for overall health prescription and would be available to answer any questions and would be speaking to our patients either in person or remotely. Two, monitoring and consultations by our health coach. That person would be ultimately very reachable, encouraging, and would provide, other than encouragement, tactical support in securing that the prescriptions are mailed, appointments happen, and the patient is overall happy with the service and results. Three, 3D body scans. Well, we all know about Ozempic body and Ozempic face. Well, the 3D scans would help with Ozempic body. It's very important to lose fat, but it's also very important to maintain muscle mass. When we put our body in a starvation mode of deficient calories, our body does not know what to burn, fat or muscle. Burning muscle is, I think, over a long period of time, becomes a serious burden on a patient's body. So the 3D scan that we're planning to do regularly, usually on a monthly basis, but it can obviously be individualized from every 2 weeks to bi-monthly, will show patient exactly where they are with their peripheral fat, their visceral fat, and their muscle mass. And conclusions will be drawn as to need for exercise to maintain the body fat. Patients who have reached their ideal amount of body fat still should not be continuing to lose muscle mass. Our body doesn't know what to burn when it's put in a calorie deficit. So basically, imagine if you are freezing cold and you're burning furniture for warmth. One thing you're not going to burn is the chair you're sitting on. So our body does the same. When we use certain groups of muscle, they don't get burned. If you don't use it, you may lose it when the body is looking for reserves. So I think continuous body scan for people who are in a maintenance phase of their weight loss is very important because it gives you feedback as to where you are right now and where you want to be in the future. Number 4, free complimentary consultations with our aesthetic providers, people who understand about skin laxity, both with age or rapid weight loss, and also professionals who are aware of other body contouring procedures that would be available. You see, fat is an organ. You could not destroy it in a point where you don't like it and you don't want that to appear there. Spite exercises don't work. If you don't want fat on your abdomen and you do extra crunches, well, that's not going to destroy the fat on top. A lot of time when people have optimized their weight loss and there are some pockets of fat that seem unsightly to the patient, they can be targeted directly. We will do consultations on that, and that would prevent the Ozempic body and Ozempic face. A lot of times excessive fat loss is in the face. It's not where we want to lose weight. We actually don't want to lose fat in our face because, that baby face appearance is having fat on your cheeks. That hollow appearance that sometimes happens with rapid excessive fat loss need to be reversed by very skilled care, like perhaps injections of fillers and artful use of Botox. And we're going to have professionals who do that and can make those recommendations, and that consultation would be included in the price of our work. So $99 a month, we think, is a fair fee for this particular service, but I have to tell you, for many of our patients who use our services of aesthetic medicine, through estheticians, injectors, through the technology we have, to many of our patients, that service would be complimentary and would be included in the price of packages for things like CoolSculpt, RF body contouring, soft wave, full therapy, lasers, facial and body fillers, and any other innovative treatment that comes our way. See, in Trifecta Med Spa, we're very confident that we can provide exactly the right complementary service to weight loss. And that's one of the reasons why we're offering that service now. We're good at what we do, and we want to relieve our patients from the anxiety of losing access to rather miraculous treatment with semaglutides, but at the same time, understanding that many people are entering into maintenance phase, or many patients are soon to be entering into maintenance phase. We want to deliver the whole package of a person not only feeling better, being in better health, looking better, but also having a positive outlook and a prospect of maintaining those improvements.